My name is Caroline Barrow, and today I'm going to talk about how intrusive thoughts negatively impact the mental health of college-age women. So just a couple of quick clarifications. An intrusive thought is an involuntary thought that comes into our minds. These thoughts are almost always negative in nature, so they are persuading us to think negatively about ourselves for any reason, and they're very difficult to redirect and to push out of our minds. And then for the purposes of my literature review, college-age women are women between the ages of 18 and 29. So to start off, I want to talk about how intrusive thoughts intensify cultural pressures and expectations. So women begin to face these societal pressures and expectations from a very young age. And many women report first remembering these messages inside the home. So hearing them from family, most commonly from their mothers. This is pretty significant because these messages build up over time and can become very significant as these women are beginning to enter college. A study in 2019 actually worked with college-age women, and researchers talked to them about what they called memorable body messages. So this type of message is a message that a young woman receives when she's young, and it carries with her and is still significant in her life as she becomes an adult. So these women talked about things they'd heard from their mothers, from other family members, from friends, peers, teachers, leaders, anyone in their life who had kind of forced these pressures and expectations on them, or just held them to these societal pressures and expectations. And an example of this would be that one woman reported remembering her mother telling her that it would be better for her if she was depressed and skinny than happy and fat when she was very young. This obviously had some serious implications for this college woman, as it does for many college-age women who have similar messages. Women are more significantly impacted by these types of pressures and expectations than men because they're simply more present for women than they are for men. On average, men have a higher self-esteem and body satisfaction than their female peers, and this is especially true in college. So to kind of give a background of what women have been experiencing their whole lives as they're coming into college, which is a time of uncertainty, of a lot of change. They're experiencing new independence, new financial stress, new educational stress. They're trying to meet new people. All of this is kind of impacted by these pressures that have been put on them since they were young. And we're going to talk about how intrusive thoughts play into this as well. So these intrusive thoughts can go on to destabilize self-esteem for many reasons. So we talked previously about how college women are more insecure than their male peers, and they actually have higher rates of eating disorders and body dissatisfaction, body dysmorphic disorder, any type of diagnosable dysfunction that has to do with body image or appearance. These are reported significantly higher among college-age women than any other demographic, not just their male peers. This is significant because as these women are entering a time in their lives of a lot of uncertainty, they are faced with this lowered self-esteem already. So many of them are going into this time with a lower self-esteem than their male peers. And self-esteem sometimes is looked at in society as a fixed trait. And this is actually not true at all. Self-esteem has an entire range of levels, and these levels fluctuate and are very fluid in our lives. So for the purposes of this, I'm going to look at fragile self-esteem and contingent self-esteem, which are two of the main types of low self-esteem. So fragile self-esteem is a self-esteem, like I talked about, that is subject to lots of short-term fluctuations. So they're having lots of changes in a short amount of time, and this is really, really common in college-age women. So is contingent self-esteem, which is when a person looks for validation in surface-level sources, such as physical appearance and in body traits. So these two are clearly very prevalent for college-age women, and contingent self-esteem is particularly dangerous because as these women are looking to kind of size themselves up in terms of physical appearance, if they're not measuring up to what they feel society expects of them, or maybe what society actually does expect of them, then they are more susceptible to increasingly high body shame and dissatisfaction as they are not reaching what they think they should be. These types of low self-esteem are particularly fueled by intrusive thoughts, which push women to seek validation in surface level sources and to undergo lots of changes as these thoughts are changing, as they're intensifying, coming more often. All these types of things can kind of further destabilize this already lowered self-esteem. Lastly, I want to look at how intrusive thoughts magnify negative self-image and food relationships. So this was really, really interesting because intrusive thoughts can actually be misidentified, and this happens pretty commonly, especially among college-age women. So a study in 2017 looked specifically at college-age women who were diagnosed with anorexia nervosa. And researchers found that these patients actually did report intrusive thoughts, but they thought of them as positive factors that helped guide them or push them to reach this then ideal that they felt society expected of them. For example, one patient talks about how she often had thoughts that felt intrusive. They didn't feel like they were even coming from her, that told her not to eat certain things, not to eat at all, to work out excessively, things along these lines. And she saw them as actually really positive things that helped motivate her to what she felt was a healthy goal or something she should be reaching. On the outside looking in, it's clear to see this is an extremely, extremely dangerous predicament to be in, because when one does not understand or does not identify their intrusive thoughts, they can actually misinterpret them to be positive or just to be something not to be worried about at all. And individuals will then go on to not work against them or try to stop them, and they can worsen because of this. They can intensify, come more frequently, and just lead to some pretty serious problems, which leads us to the transdiagnostic nature of intrusive thoughts. This was interesting too, because intrusive thoughts actually can kind of travel from one diagnosis to another. And so, for example, a patient, let's say, is diagnosed with body dysmorphic disorder or BDD, and they have intrusive thoughts telling them that their body is not good enough, that they are perceived to be ugly by those around them, something like that. If these thoughts are misidentified, or if the patient just doesn't seem to care about them, what can actually happen is these thoughts can worsen to a point where now they pushed this individual into a state of having a diagnosable eating disorder or to a diagnosable obsessive compulsive disorder, something along those lines. As the thoughts worsen and become more frequent, they can connect multiple types of dysfunctions and psychological issues. These intrusive thoughts also, as they do this, they begin to actually damage our self-concept. So self-concept deals with more than just how we look, but it also deals with what we're capable of, how we act, if we're a good person or not. And as these intrusive thoughts become more frequent and more aggressive, they can start to push someone to question who they are as a person and whether or not they have worth intrinsically, which is very dangerous. And many college-age women are susceptible to this as they undergo stress and pressure they've never had before, paired with the stress and pressure that's been put on them their entire lives. If they are at a point when they misidentify intrusive thoughts, or they don't recognize them at all, or anything along those lines, they can start to really become a problem and connect all these different types of dysfunctions within their minds, mental disorders, and can start to make them feel extremely poorly about themselves outside of just their body image. So something that I think could be really, really, really helpful in combating this would be self-compassion. So self-compassion has been found by researchers to be directly inverse to low self-esteem and body image, or a lowered self-concept. So where low self-esteem or self-concept focuses on being judgmental of yourself, harsh self-talk, being overly critical, finding weaknesses to be like really, really detrimental, self-compassion focuses on treating yourself with kindness, seeing weaknesses as just part of the human experience, something that everyone undergoes, and seeing these weaknesses as opportunities to grow and to have positive change. Self-compassion emphasizes patience with yourself and kind self-talk, and just being understanding with what you're going through and changes in your own life and how you respond to them. I think this can be really helpful for a number of reasons. I think that teaching self-compassion to girls from a very young age can help these women these girls to develop a secure sense of self early on in life. And this will help them to build upon that sense of self-worth and this strength and self-concept as they grow into adulthood, or into being a teenager, to going to college, anything like that. It will help them combat these intrusive thoughts and the negative impacts of them, because they'll be able to recognize immediately that they are something negative, something that's untrue, something that needs to be pushed out of the mind. And they can kind of combat this pressure that's put on them externally. It helps them be sure of who they are. This in turn combats feelings and fears of isolation, because you can recognize weaknesses as, just like I said earlier, part of the human experience. It's part of growing and changing and learning, and they can really be a positive thing when you're compassionate with yourself and you see them as ways to progress wherever you are. Self-compassion also promotes mindfulness, like I talked about, with positive change, and just an overall happy and healthy lifestyle, which is something that college-age women deserve, and something that they need to be successful as they move through their studies and into bigger and better parts of their lives. They need to be sure of themselves and their capabilities. Thank you so much. My email is cgracesparrow@gmail.com if you have any questions or ideas for future research.